Hi guys, we're here with Dana. We're going to be going over a 3-part series on myofascial release using the foam rollers and the lacrosse balls. Myofascia is a tissue that surrounds your muscles and bones, tends to get pretty bunched up tight, can cause some pain, definitely restricts some movement. And over the course of the series, we're going to be teaching you how you can use these different implements in your daily routine to release that tension. Okay, first off, let's talk about some different types of foam rollers. We have the ones that are actually made of foam, coming in a couple different sizes. That's a full-size one. We have some half-size ones. They also come in different colors. Normally, that is going to tell you the density of the foam roller. If you're new to foam rolling or you're coming off an injury, then a reasonably soft one's going to help. Most of our athletes, it's just too soft. It's not going to give you the amount of pressure that we need. We also have the kind of fancy types that we like a lot for if you're going to be throwing them in your bag because they're pretty indestructible. And then if you're hardcore and you get used to it, we use just the plain old PVC pipe. All of these can be found in most sporting goods stores or on, say, an Amazon.com. All right, first off with Dana, we're going to get down on the ground and we are going to start by doing your hamstrings, the back of the leg. We like to do one leg at a time so that you're not favoring one leg more than the other. So the leg that is on the foam roller is going to be straight but not tensed, and then we're rolling from the back of the knee all the way up to the bottom of the glute. Try and keep as much weight on the foam roller as possible, not your off leg, and then not your arms. So next we'll transition into the IT band, which is along the side of your leg. It's a reasonably thin strip. You'll know when you're on it because it's going to hurt an awful lot more. This tends to be a pretty tender area. So you're rolling now from the bony outside of your hip to your knee. We're not crossing the joint. This one you may need to use a little more weight on your foot and your arms. And then lastly, we're going to roll onto the front and we're going to do the quad. Quad's a much bigger muscle group, so we're going to be able to kind of roll internally, externally, angle a little bit more, find any areas that are causing you some problems, focus a little bit more on that area. We shouldn't be feeling extreme pain, just a slight bit of discomfort. If you are feeling pain, take a break and then slowly just try and increase pressure onto that area.
All right, now we're going to move on to our adductors on the foam roller. So John is going to get down on the ground. He's going to place the foam roller kind of perpendicular to his adductor, the inside of his legs. He's going to use his arms for a little bit of support and roll from the bottom of the hip to the top of the knee, making sure not to roll over the tops of the joints. He can roll a little bit internal and external to find some tighter spots. If you find a tight spot without a ton of pain, kind of do some small rolling in that area. If it's really bad pain, take a break, move into a different area. Now he's going to come into the glutes. So a couple different ways to roll your glutes. The first one, which I like, is to put your working glute, the glute you're going to roll, take that foot on top of the opposite thigh, and that'll put a little bit more weight and stretch that glute a little bit more while you're rolling it. Or if that's too much and too intense, you can always put the leg straight out. And again, feel free to move side to side when you're doing this so you can hit all angles of the muscle. Last one we're going to do is calves. So with calves, we're going to go to the meat of the muscle. So we're not going to roll the back of the knee, just the meat of the calf and stay off of the Achilles tendon. Okay, we're not going to roll all the way down to the bottom of the ankle. So we're working with a smaller area when we're rolling our calves. All right, guys, that concludes our first part on foam rolling. Remember, you can foam roll before you go out to practice, before you throw a bullpen, before you go hit, and before you train. So foam roll before you do any movement of any kind. If you have any questions, contact EM, and we'll be more than happy to help you.